The ED telehealth service is an after-hours medical service delivered to urgent care centres using video conferencing from a regional emergency department when an on-call GP is not available. Hub and spoke models can be set up to support local patterns of referral, with the service being provided from regional emergency departments to their catchment hospitals. Telehealth is designed to offer efficient treatment with the emphasis on preventing travel. Doctors in the emergency department use a desktop video conferencing unit to consult with the patient in a remote location. Each urgent care centre has a wireless mobile practitioner cart or PRAC cart, which is placed at the patient's bedside and can be used to provide real-time face-to-face communication throughout the consultation. A formal protocol has been developed for this service to ensure that the ED telehealth service is a safe, high-quality medical service. It is the same for all health services, with slight variation on hours of service and inclusion of triage Category 3 patients where appropriate, when no doctor is available in that locality. Clinicians must practice within the parameters defined in an agreement between health services. The method is summarised in this flowchart. The process stipulates how patients are to be referred for telehealth, entered into the emergency department workload, managed during the consultation, and how documentation is to be completed and exchanged with the remote site. More site information can be found in the Site Information folder that is kept by the VC unit. This video will provide you with a practical guide on how to conduct a medical consultation via telehealth, and at the end provide some practical tips on how to optimise the quality of the video.
So Shirley, this is a telehealth, the screen. This actually logs into remote hospitals, little community hospitals, Beechworth, Yarrawonga, Bright. And the intention of this is you've got patients who come there in the middle of the night and the GP doesn't really need to be rung about them. And it's the sort of patient you can treat via this video link. The guy with recurrent back pain who needs some narcotics for his pain, that's fine. If you've got an old bloke with first presentation of back pain, that's not going to be fine. You're not going to be sure what's going on and he'll need to come down. So you want to make sure it's safe for the patient, safe for yourself. You can imagine a kid who's had some vomiting and some diarrhoea and they just need some ondansetron wafers, some fluids. You review them in an hour and they're fine and they can go home and be reviewed by the GP in the morning. They're the sort of patients we're looking at treating. So what you're going to see on the screen is Beechworth. In a sec you're going to put your headphones on. Just be aware, telehealth, you've got a really experienced nurse who's actually your brain and your hands on the site.
Terry, we haven't got a doctor on call tonight, so I'll put you on the telehealth program where you talk to the doctor on the camera. It's really good.
She's done all this before. She's actually worked out this patient's suitable for telehealth. She's going to be doing the treatment with the patient. She'll be interacting with the patient.
Good evening, Doctor. I'm Debbie, from the registered nurse from Beechworth. Doctor, I'd like to introduce Terry to you. Terry's presented tonight with an acute exacerbation of neck pain.
The neck pain is the main problem that brought you into hospital today.
So your treatment plan is going to be run by the patient, but a lot of the work is also happening with the nurse.
Deb, is it possible to sit Terry up so we can start the examination part of it?
Certainly, Doctor. I'll just move the unit back so that I can sit Terry up, and then we'll just reorganise it once I've got him sitting up, if that's okay.
She's experienced and she'll be doing the work, so make sure you talk to her about the plan.
I'll just get you into the legs over.
She knows what's going on. She knows her community far better than you do, and they're all experienced doing this.
So can you raise your arm up like this?
I can see where the range of motion and how much is limited.
Well, it stops there.
And again, in that setting of trauma and your limited movement and that increasing quite severe shoulder pain.
Look, the patients you're treating with telehealth, you need to know it's safe to treat. There are some patients who say, I don't feel safe with this, they need to come down. You don't have to treat everyone by telehealth.
And I really do think an x-ray, some imaging would be warranted for this situation. So I would really like to bring Terry up to Wangaratta
and do all those examinations and investigations myself.
So, Doctor, did you want to do that tonight, or did you want us to organise that in the daylight hours?
I think this is something that can wait.
Okay.
It's quite late at night and I understand, resources are limited, but if we give Terry adequate analgesia overnight, then tomorrow morning we can send him first thing in the morning. And once Terry is able to drink fluid, is happy, pain is under control, then we can get him home.
Do you have any further questions for us at this point?
No, thank you very much for your time, Doctor.
Look, telehealth is a way of saving patients having to hop in the car, drive down, or call an ambulance for something they didn't need to call an ambulance for, to be treated when they could have been treated at home in their local community, in their local hospital, with a nurse there, and you able to prescribe some medication or some fluids that's going to keep them safe and save that drive down. Typically you'll find after the first couple of consults you'll feel quite comfortable with it, and it's about 1 consult a night we're running at. All the residents have found it's fine, it's actually easy to do, it's not as challenging as you first think. Okay Shirley, I just want to go through some of the paperwork. This will be an ISBAR format that comes from the remote site. So what it is the remote site's actually sent all this stuff off to us, it gets printed out, and that's got the information about the patient, the situation, the background, what they want done.
Now, you there, Deb? Yes. I've just received your ISBAR sheet.
Sometimes it might just be, look, I need a script for some narcotics for this patient before they get transferred. The clerical staff will put the patient on the list for the day. They'll tell you there's a telehealth patient and what their triage category is. You just need to organise your workflow so you can get to see that patient via this telehealth consult. No, it's a telehealth. Okay. There's a separate sheet which is it's in yellow, and that's actually where you record your notes. So it's a different colour to the normal ones, but it's very much the same sort of set out as what we do, but we colour it yellow just so we can find it again. It's quite a different process. On the bottom of it, you'll find there's some medication. So when you prescribe for the place, you're going to sign your medications or maybe some IV fluids, and that's going to be faxed back to the remote site, to the small hospital, where they'll use this to dispense medication to the patient or get some IV fluids up for the patient. And then emailed off to Beechworth.
Yes.
And then we're done.
Great.
It's finished.
You.
Thanks a lot.
Thank you.
At the end of the process, there's a little evaluation form just where you write down your thoughts about how you thought it went, how the process went. There are GP consultations available have the patient reviewed the next morning. So just make sure the patients are safe and you're feeling safe with it.
Now that you have seen a practical example of consulting by video, I'm going to give you some tips on optimizing the quality of video. Be aware that there is a short lag phase of 1 to 2 seconds when using video conferencing.
Scenario?
No, certainly.
Okay, so let's
It can make the conversation a little stilted, as the sound at one end will interrupt the sound coming back from the other direction. It's important that the patient can see you well and hear you well. Good lighting is important. If you are looking a little dim on the screen or over-illuminated, adjust the lighting at your end to achieve a natural colour. For good sound at both ends, position the provided headset microphone close to your mouth to reduce background noise from the emergency department. Use of the headset also ensures privacy when communicating with the patient and/or nurse. The patient's image must be out of view from any passerby. If you are not in a dedicated office, this can be achieved by angling the VC unit towards a wall or corner of a space with no traffic. If you believe there is anything compromising patient privacy and confidentiality in the patient's environment, for example, an open door or open curtains, just point it out. The privacy and confidentiality of a telehealth consultation should be equal to that of a face-to-face consultation with a doctor in the urgent care centre. It is important that the nurse is with the patient for the whole consultation, and that starts with putting in a telephone call to the remote nurse just prior to making the VC link.
Going over in daylight hours.
As the consulting doctor, you will be leading the consultation, a bit like chairing a meeting. Introduce yourself and invite the patient and nurse to do the same.
Good evening, my name is Shirley. I'm one of the residents here.
State the situation from the ISBAR referral and ask the RN to contribute.
Good evening, Doctor. I'm Debbie from the registered nurse from Beechworth.
And then start the consultation with the patient as you would face to face. At the end of the consult, reinstate the treatment plan for the patient and invite questions from the RN and the patient to ensure all is understood.
Do you have any further questions for us at this point?
No, thank you very much.
It's important to look at the camera positioned at the top of the screen periodically. It's natural to want to look at the patient's face when you are talking to them, but the image conveyed to them will show you looking around their chest level. It's really difficult to look at the camera the whole time, but make sure you do it from time to time. Eye contact is good for engaging the patient. And finally, If you are unsure of any part in the process, speak with a senior nurse in the emergency department or senior medical staff when available. Be sure to fully complete all documentation, including consult start and finish times. At the end of your shift, you'll be required to discuss the telehealth consultation with the senior doctor at handover.